Okay. Is it recording?
Yeah, yeah, I think so.
Yes, it's recording now. So I'm going to pass the control over to Emily and Sabrina, who have graciously agreed to join us today. And yeah, go right ahead.
Cool, Sab. Do you want to start or me?
You go first. Go
Okay.
alphabetical.
Okay. Okay. Hi, everyone. I'm Emily. Thanks for coming out. It's a really good turnout tonight, it seems. I prepared a little PowerPoint of just my med journey. Please interrupt at any point if there's any questions or write them in the chat, but I don't know if I'll be able to man the chat while I do this, so hold on.
I can man the chat for you.
Okay, perfect. Thank you. Um, okay, can you guys see my screen? I think I spelled that right. Cool. So I'm Emily, and I am a second year medical student at McGill, and I would love if my thing would change slides. Anyone know how to do that? Oh, there we go. Okay, so I graduated from Bialik High School in 2017. I had no clue what I wanted to do with my life. I knew I liked science. I knew I liked people. That was about all I knew. So I went into pure and applied science at Dawson, and that's where I started kind of getting my feet wet with healthcare. I would shadow. I started doing some research around then, but CJEP's hard. It was really just mostly school. In that time, I also realized that pre-med was not for me. I needed to grow up. I needed to mature a little bit. I needed to do an undergrad. And so I applied to nursing at McGill, and I did my bachelor's of science in nursing, which I graduated from in 2022. So don't do the math of how old I am. I then worked as a nurse for 2 years in surgical oncology. I know this is a talk about medicine, but if anyone has any questions about nursing, I'm more than happy to answer them. I loved being a nurse. Obviously, that's not what I'm in anymore, so there were some reasons why I switched, but being a nurse was amazing and taught me so many things, and I made so many great friends and met so many great patients, and I loved what I did, but ultimately decided to switch into medicine. So I'll go over a bit about my application. So I applied to medicine 3 times, which is actually the average in Canada, which definitely helps mentally when you get rejected or waitlisted, just to know that, it takes a lot of tries to get into medicine. So I wrote my MCAT in summer of 2020 when there was really nothing else to do because of COVID. So I wrote that. I scored a 514, which I don't know if anyone knows anything about the MCAT, but it's a averagely competitive score. So with that, I then applied the following year, which was the year to start the year after I finished my undergrad. I applied to Dalhousie, all the Ontario schools, and all the Quebec schools. I only got one interview at University of Montreal, where I got waitlisted, and I never made it off the waitlist. And so I started working as a nurse. The following year, my MCAT had expired, so I couldn't use my MCAT anymore. So I only applied to the Quebec schools and University of Ottawa. I interviewed at the University of Montreal and McGill. I was waitlisted at both and never made it off the waitlist. And then finally in 2023, I again applied to the Quebec schools and University of Ottawa. I only got an interview at McGill. I got waitlisted at McGill, but I was number 7, so I finally got accepted. And I started med school. Just about my application. There's my CV. That's the McGill format. But I had a fair bit of work experience. I obviously had been working as a nurse, but I also worked throughout undergrad. I worked at Mandy's, I worked at summer camps, I worked at, just your regular old jobs. Volunteering is important, research is important, but they don't expect you to have 1,000,001 publications at this point in your trajectory. Extracurriculars, they like to see that you're a well-rounded person, that you're not just all school or all research. So all things like every aspect of the CV is important. I applied with a 3.9 GPA and a fourth quartile, quintile, I don't know what it's called, whatever, of Casper. So I got into med school. What does that mean now? What does my life look like now? Very different. So it's very much structured as a high school schedule. Uh, we have lectures every morning from 8:30 to 11:30. Then we have lunch. Then in the afternoon, we either have more lectures, small groups, which is um, we're divided into groups of 15-ish people, and we're connected with either a resident or a staff physician or a upper year medical student who's really interested in the specialty that we're studying that day. And we kind of just go over clinical cases to put what we learn in class into practice. So, for example, we're now in our neurology block. We're doing the psychiatry section of our neurology block. So, yesterday we had a small group where a psychiatrist came and we watched some videos of patient interactions and then kind of unpacked them. What was done well, what was done poorly, why is this the diagnosis, how would you treat it? Just so that we're not just being thrown information at us and are really taught how to apply it. After school is done, which is around 3:30-ish every day, study. It's a lot of content thrown at us every day. But in addition to that, it's clear that the CV to get into medical school has to be quite robust, and it doesn't stop once you get into medical school. You still need to keep up all of those things to apply to residency. So you need to continue with the research, with the volunteering, with clubs, with involvement, with your extracurriculars. You still want to see your friends. Um, so it does become a lot. In terms of the research that I do, I'm interested in surgery. So I do research in urology, gynecology, general surgery, and medical oncology. I volunteer at the family store. I'm a student ambassador, which is why I'm here today. I'm a note taker, and I volunteer at the Contactivity Center, which is a center for the geriatric population that just runs activities. It's really not volunteering. I kind of just play pickleball with them. Would recommend. Um, Clubs, very involved in student life. So I'm with the Addiction and Harm Reduction Interest Group, the Association for Women Surgeons, the Medical and Dental Jewish Association, the Urology Interest Group, the Student Surgical Society, the Anatomy Club, the Robotic Surgery Student Association, and I also still work as a nurse. I only do one shift every 2 weeks, but I do still work. So as you can see, it's a lot. We're in school from 8:30 to 3:30, and then you have to do a lot of things outside of medicine. So I would say that if you're not sure that it's what you want to do, I don't know if it's for you. Like, sorry, but it's so much, and you have to love what you're doing, and you have to be so into it and know that this is what you want because it gets very easy to just get down and get lost and overwhelmed by all the responsibilities. That said, there's fun things too. That's the real day in my life is that we have lunch as our friend group every single day. On Mondays, I'm in a soccer league. On Tuesday night, I watch Dancing with the Stars with my friends. On Wednesday night, I mean, Dancing with the Stars is finishing, so I might have to switch up my schedule. But Wednesdays, we all go to the gym together after school. I'm part of the Med intramural basketball team. We mostly play on weekends. Every Saturday night, I have dinner with my friends, and every Sunday morning, I have a standing coffee date with my grandparents. So there is a way to balance everything and keep your social life going, and you can't do that without a great support system. It's super important to keep you going, not only in med, as you can see, all our white coats in the middle, but also outside of med to, keep that balance and really have a life. So that's all I have for you. If you have any questions, do not hesitate to email me. I can also answer any questions now. If you guys want to just speak up, or have there been any in the chat? I can stop my screen share. I do that. Stop share. Cool. Does anyone have any questions?
If no one wants to ask questions now, I can also go and then maybe you'll have like a good idea of like what you want to ask once you've seen both. And you can like direct questions at both of us.
There's a question. What classes do you need to take before the MCAT? So all the CJET prerequisites will basically cover you. And there's a big biochemistry section. So taking kind of like a 200 level university biochem course or like a bio 200 kind of thing will probably help with that. That said, because my undergrad was in nursing, I didn't take any of those courses. I mean, I took the CJEP ones, but I didn't have any basic science courses in my undergrad. So there's prep courses online that really just get you prepared and get you through it. I think I did the Princeton review one. Did you ever consider applying to American medical schools? Was there a reason that you didn't end up applying? purely financial. I thought about it, I looked into it, I looked into the Ireland schools as well, or even the islands, and it was purely a financial decision not to apply. It's very expensive to go to the States. Not only tuition, but living, and takes a long time to start making money. It's a med school is a long process. So that was the reason for me. Sab, you want to take it away and I can man the chat?
Yeah, sure. Okay, give me a second to get her booted up. Okay. Um, right? Like you see it in like presenter view? Okay.
Yes, looks good.
Okay, so a lot of what I'm going to say is pretty similar to what Emily had to say. I'm just going to go over, I guess, like my timeline for getting into med. But I also really want to emphasize now, and of course, I'll emphasize it throughout my presentation as well. I don't think that anyone's path to medicine is linear. And I don't think that, that's for no reason. I'm happy and proud with like how I got here, even though there were some twists and turns. And I think you'll see throughout my story why I think that worked out for the best. Oh, okay. So I'm going to kind of breeze through this part, but I do think it's important to kind of give context to the rest of my story, even though I understand you're all past CEGEP at this point. Um, I would say like tail end of high school and then getting into CEGEP, I didn't have any idea of what I wanted to do. My interests were pretty varied. I liked a lot of things. I was always a pretty good student, very involved. I went to an all-girls school here in Montreal. I wouldn't say it was like catty, but it was definitely competitive and like keeps you on track, keeps you motivated and aiming high. And I succeeded in all of those things, like I was never lost because I was a bad student, but I was definitely lost because I just didn't know what I liked. However, get to the end of high school, most of my friends are applying to a science program. I liked science, I was good at it, so I followed suit. I ended up in Pure and Applied at Dawson. I spent a semester there, hated it, and I had a friend who was switching out of Pure and Applied into psychology. That worked out really, really well for her. She's now doing her PhD in psychology at McGill. However, it did not work out so well for me when I followed her idea, also switched out of Pure and Applied, landed myself in social science, and hated it probably even more than I hated Pure. I didn't feel like I was being super stimulated academically. I didn't like the classes. I still didn't have a better idea of what I wanted to do. I thought maybe by like narrowing my options down, it would force me to really think within like a box as opposed to having all of these options in front of me that were kind of overwhelming. Um, but it did the opposite. I think if anything, it made me think my options were better over there. There were a lot, and it was overwhelming to think about them, but at least I liked them. And I didn't love the classes that I was taking first semester, Dawson, but I knew that there were better ones coming up that I had a chance of enjoying. So I made the decision to switch back. Because of the double program switching that I did, I ended up spending 2.5 years at Dawson instead of the regular 2 years that it would normally take for a deck. Again, this was pretty daunting at the time. As I've made pretty clear, I hated my experience. So the idea of spending an additional 3 months in CEGEP where I felt really lost, I felt really confused, obviously wasn't a pleasant thought. Ultimately, I ended up exactly where I wanted to be and where I'm happy. And so it was definitely worth it. But I think having those kind of early introspections and early confusion definitely helped kind of clear my path up going forward. But at the time, a lot of growing pains going on at this point. So I finished CEGEP, still don't know what I want to do, still not thinking about medicine. I never applied to Med P. And as Emily mentioned, I'm just going to echo this thought. So happy that I did not do Med P. I think you grow tremendously in your undergrad. You come in not just with more knowledge, but just more like experience under your belt, a greater sense of kind of who you are, more maturity, and really, really pleased with the path that I took in that sense. But I was still a little confused about what I wanted. I'm lucky that I have very supportive parents who kind of instilled in me this idea that education is not a means to an end. You don't go to school and get a job, you go to school and you learn, and then a job comes. So I pursued one of the quote unquote useless undergrads at McGill. I was an anatomy major. I'm sure many of you know anatomy majors. Great major. I had a great time. I learned a lot and I loved what I was learning. but there's not much that you can do with it, right? You kind of even either need to go the grad school route or the kind of like med OT PT route, where you end up in healthcare. So in my first year, it was full lockdown COVID. Obviously, a sad time, took a lot kind of away from my overall McGill experience, but I think at the same time, it kind of forced me to really immerse myself in school and in my classes, what I was learning, figure out not just, you know, okay, I like the program, but like, what is it about the program that I like? And also, what is it about like a future career that I think would kind of fit hand in hand with what I'm enjoying school wise? And that is really when I started to think about medicine as an option for myself. Prior to that, it was never even on the horizons. Another thing I really want to emphasize, like, you don't have to be one of those people who like said they wanted to be a doctor from the time they were 7. I said I wanted to be a doctor from the time that I was 21. Like, no one's path is linear. Everyone's trajectory is going to be a little bit different. And I don't think that you ever realize it like too late. There's people in our class who are in their 40s and they're right here with us, like in the trenches, but they're going to get there, you know? Um, so at this point, I kind of figured out pretty early in my undergrad, med is what I want, med is where I see myself going. And I think now finally having that light at the end of the tunnel was really motivating for me. I think it forced me to make the most of my last 2 years of undergrad where lockdowns were being lifted. I was able to have a kind of normal undergrad experience, get involved, meet people, um, join clubs, volunteer, whatever it may be. And also stay like focused on the grind and focused on like where I wanted to end up. Um, that motivation, I think, kind of carried me through again, like a pretty rigorous undergrad. As Emily said, like it's not easy getting here. It doesn't get easy once you are here. But I think that if you kind of keep that goal back of your mind at all times, it does lighten the load a little bit. I have my stats here. I also want to emphasize you don't need these stats. Yes, your GPA matters. Yes, your CV matters. Your Casper score as well. I didn't put it here, but I was also fourth quartile Casper. I don't think that those are the reasons that I got into med. And part of why I don't think that those are the reasons is because those were my stats the first time I applied to med and I didn't get in. I think that initial rejection after applying once I completed my undergrad really kind of like burned me at the time. I remember waking up the next morning. I was waitlisted, but I was pretty far up and kind of knew like it's out of reach this year. I remember waking up the next morning and not being able to open my eyes because I'd cried so much and I was so swollen. But nonetheless, like life throws you curveballs and you have to bounce back. It was tough, but I think it also forced me to recognize that the perfect GPA and the strong CV and the, top quartile on your Casper is not what makes a good med student, and it's not what's going to make a good doctor. And so I now, at this point, had a year ahead of me where I was able to grow, reflect, identify my weaknesses and my flaws, and work on them, and kind of put in my head that, like, hopefully it's next year. And if it's not, it'll be the year after. But, like, you've got to address these things instead of moping and move forward from here. So, what did I do in that year after undergrad? I initially studied for the MCAT in the fall. I took the summer off. I traveled. I kind of like celebrated finishing my undergrad. I think something that like not getting into med immediately after finishing kind of like robbed me of, because I thought I was going to be studying med and I wasn't. Um, but I took the summer off and then come fall, kind of like snap back into what am I going to do to get to where I want to be. I studied for the MCAT for about 4 months, which is a little bit longer than what most people spend studying for it. If you have more questions about that, I'm happy to answer. I wouldn't recommend studying longer than 3 months because it's long, it's rigorous, and it's really, really boring. And I burned out and I never ended up writing it. I told myself, if you don't get into McGill this year, you'll write it, you'll cast a wider net next time. But for now, just focus on your top school. And I reapplied to McGill. I also didn't mention it before, but both times that I applied to med school, I only applied to McGill. Again, if you have any questions about that after, I'm happy to answer them. But that was just a personal choice. I had a great undergrad experience. I love Montreal. My family's here. Most of my friends are here. And it just made sense for me to go through a program that is objectively really, really challenging in an environment where I felt confident and comfortable. And then in the winter of my post-grad year, I started a master's in neuroscience at the Neurological Institute, so at McGill. Also a really amazing experience. If you're considering grad school, I would absolutely encourage you to look into it further. I didn't end up finishing my master's because at this point I had applied for the second time, I interviewed for the second time, and I got in. Some people are able to finish a master's while they're in med school. For me, it was like a very bureaucratic issue that stopped me from doing that. I hadn't taken the classes that I like, there are course credits as well as thesis credits. I hadn't fulfilled my course credits, and you're not allowed to be enrolled in two programs courses while in med school. So being enrolled in my master's classes would have stopped me from enrolling in my med school classes, and so I had to drop one. Had I just done my classes and only been working on my thesis in med, that would have been okay, but that was not the case for me. So I had to walk away from my master's. I'm still part of the lab. I'm still working on my project. It's a very clinical project, and so it's highly relevant to what we learn and what we do every day in med. But really like a great experience, and I didn't walk away from it out of choice. So again, if you're considering grad school, I had a great time and really like learned a lot, even though it was a brief stint. But yeah, I got into med school. I was overjoyed. It was really like a surreal moment. I can like picture the day like a movie in my head. Um, just I'm sure Emily can attest to that feeling too, just like something you've worked towards for so long finally coming true. Um, and now what is it like that I'm here? I'm not going to go through the day to day. Emily kind of gave you the lowdown of that, but I have made some of my very, very best friends in med school. I wouldn't say that this journey would be the same if I didn't have these people in my life. You can see Emily in a bunch of these photos. You can also see Derek horizontal in the center here. He was one of you guys. He was a kin major. Um, but truly like the best, most fun, most supportive people. You're gonna meet a whole variety of characters in med, but I think what's really fun is like it does attract a specific group of people, and so you will definitely find your people, and that has made it just like a hell of a lot more fun. Um, I also got assigned the best mentor in the best Osler group, something that, if you're considering McGill, I think really adds to our curriculum are these Osler groups that we have. Before you start med, you get put into a group of, I would say like 6 to 8 students. My group is 7 of us, and you get assigned a mentor, so a staff physician at one of the MUHC hospitals. And you meet a few times a year. You kind of like discuss your path through med and your like trials and tribulations, but also like your little wins along the way. You can ask them questions about like career paths and what med school was like for them. It's really nice to have someone to kind of like defer to for all of your questions. I got especially lucky because I'm primarily interested in pediatrics, and my mentor is a neonatologist. She's a neonatal ICU doctor at the Jewish. So that's really kind of like broadened my horizons in terms of the options available to me in peds. So really just like a great experience overall to connect to people who you might not necessarily like sit with at lunch and be friends with on the day to day, but nonetheless like really incredible people. And also a mentor to really like guide you through med school. Um, and I was also put in the best small group. Emily spoke a little bit about small groups. We have the best time. We hang out outside of school all the time. We have small group birthday parties for everyone. This is me and Manon. She's our one international student in our class. She's just from New Jersey. She's like not exotic, but we love her. Um, our birthdays are like close together, so we had a joint birthday party, but like truly like so much like love and celebration going on between everyone in the cohort. I really can't complain. But I also want to emphasize that I still have other things going on in my life, and you absolutely will be able to make time for these other things. Yes, I love my med school friends. Yes, I love my small group and my Osler group, and I truly, truly do look forward to like our Osler meetings and like when I get to hang out with my med friends. But I have a dog. I grew up in Montreal, so most of my friends, like I said, are here. I still obviously want to make time to see them. Like Thanksgiving dinner with my family, like one of my highlights of the past few months. About 8-ish months ago, I became a certified Pilates instructor. This is me planking at my friends and family event. So you really will have time to like explore other things. I think another kind of like silver lining about being in med school, and like Emily touched on, you are in school for a really long time. You do kind of feel like your life is like put on pause relative to your friends who are maybe on like a faster moving track than you are. But I think the silver lining to that is you do kind of have extra time before you're like a full-blown adult. And that allows you the opportunity to kind of like explore other paths and other interests of yours before it's time to like hunker down and be a grown up. So really like can't complain about like being kind of stuck in this phase of my life. It's given me so many opportunities, allowed me to meet like really, really incredible people. And I hope that you're convinced that, it's a long journey, it's a tough journey, but overall, it's definitely worth it. And there's absolutely a light at the end of the tunnel. Neither Emily nor I had an easy, clear-cut route to get here, but ultimately, I think we're both really pleased with how things worked out for us. And I really like wish you guys all the best, and I hope you can find the same kind of like comfort in your own journeys to getting here, and good luck. How do I stop? Okay. So yeah, if you guys have any questions.
Hi, thank you for your presentation. It was really informative. So I have a question for you and also Emily. I feel like you both would be well versed on this, but like I feel like for me, like my biggest struggle honestly is time management because as much as I can like try to like get really good grades, I don't feel like I'm able to like fit in everything that I would want to get fit in and like actually feel like I'm well rounded on other things that are interesting to me. So what do you think is like really key and like what has really helped you to manage your time in like studying and actually like studying well and also being able to like commit yourself to other things?
Um, okay, I'm gonna give you two answers. I think that the answer to your question relevant to when you're in your undergrad is very different from once you're in med school. In your undergrad, I think the biggest, scariest part, and the reason why people say like getting in is the hardest part, is because you are trying to get that crazy high GPA. You are trying to also be involved in a million extracurriculars. And so it's like you can't like let one thing go, or at least it doesn't feel like you can, because you have to be, as you said, like well-rounded in every category. But what I would say is like my biggest piece of advice, I didn't talk too much about what was on my CV, but really I think that a strength of my application and also what kind of alleviated the burden for me when I was in undergrad was focusing on things I liked. Like you think you know what they're looking for. I promise you, you don't, because talking to people in our cohort, like everyone has done things I didn't even know you could do. Like the diversity of experiences is ridiculous, and things that I did, someone else may not have, and vice versa. And so to feel like, I have to have something in XYZ category and check all the boxes, no, you don't. Focus on what you like, focus on what's fulfilling and enriching to you. I think that's going to motivate you to stay kind of on track with your extracurricular obligations. And then it'll also force you to say, if I want to enjoy doing this, I have to make this time that I'm spending studying all that much more productive and really like sit down and focus. So I hope that answers your question for undergrad. In med, as Emily said in her presentation, unfortunately, it does not slow down. You're still busy. You're still working towards CARMS matching and, figuring out what like residency program you want to be in, what you need to do to get there. It kind of varies depending on where you want to end up. But what's nice about med school is it's pass fail. And no one will ever ask you what you got on an exam. It does not appear on your transcript. Nobody cares. So all you have to do is pass. It's a bit of a learning curve at the beginning to shake yourself out of the mindset of like, I need to get 95 on this, to now be like, actually, all I need is a 60 and no one's going to be able to tell the difference. But it does kind of alleviate the burden of like, I have to know every detail on every slide of the PowerPoint so that I can one day match carbs. Like, no, you don't. Like, you just need to pass. And that is like a big, big load off your shoulders to then commit time to other things. So it's like a different type of time management, but nonetheless, I think just like prioritizing and genuinely like liking what you do. I don't know if Emily wants to add anything.
No, I think you hit all the points. Doing what you love is so important on your CV because they can see right through it when it's like, oh, I have a million things on my CV, but they're all for 2 months and then I moved on to the next thing. Whereas like, okay, I grew up playing a bunch of sports. So then in my hobby section, I put, I don't even remember what sport I put. And then in the work section, it was like worked as a soccer coach. And then in my volunteer it was like volunteered for Special Olympics Canada, like teaching sports so that you can kind of see a theme. And that also, like Sabrina was saying, really helps with like, okay, I don't feel like I'm going to volunteer now. Like, shoot, like again, I have to go volunteer. Like I have so much studying to do. It's like, no, like this is so fun. This is what I love doing. And they can see through that on your CV during your interview. Which kind of segues well into the next question that I see in the chat, which is what changed between your first and second application that you think contributed a lot to getting accepted? So I can start with this one, I guess. One thing that we didn't touch on in either of our presentations actually is kind of how getting in works and like the application process. So I don't know if you guys like some of you have applied already, some of you are thinking of applying next year, but basically you need three things to apply: a CV, your grades, and a Casper. Your GPA is weighted for 70% of the application, your Casper for 20%, and then your CV for 10%. So really your CV like does not matter that much. You do need to do all the things, but it's only weighted for 10%. Um, Once you've like hit all those criteria and they say, okay, you're gonna get an interview, everyone's on the same playing field. So they're not looking back at your interview and saying, oh, well, you volunteered here, but this person worked more, but this person had research and this person had a better GPA. Like it really all comes down to your interview. So for me, like Sabrina was saying in her presentation, like it not getting accepted one year versus getting accepted or invited to interview the next, where not that much had changed. I think for me, what really made the difference in having interviews every year and getting waitlisted was how I approached the interview, which obviously you have to get to the point of getting an interview, but I know it sounds so crazy to say, to be like, you really just have to chill because you're going into your med school interview and you're like, no, I can't be chill. Like this is my med school interview. But I think they saw through my anxiety the first few years. And I think in my last year I said like, you know what, you've been waitlisted all this time. You're clearly a good enough candidate, like that if you got off the wait list, you'd be a medical student. Um, just be you, be authentic, relax, breathe. Like I think that's what really made the difference for me was breathing and relaxing, and easier said than done. I know looking back now I can totally see that, but I think that's what made the difference for me because my GPA stayed the same, my CV stayed the same. I got the same Casper score every time I took the Casper. So I think sometimes it just comes down to a bit of luck in terms of if they're going to accept you to interview, but then it's really the interview that counts for everything. I hope that answered.
Yeah, I don't have much to add to that, honestly. I completely echo everything that Emily said. I was in the same boat where I got interviews both times. My GPA, CV were like GPA was exactly the same. Casper was the same. CV pretty much the same. Like really not much changed. The first year I applied, I prepped with a girl who I knew who's now in her fourth year, I believe. She's awesome. Like really nothing bad to say about her. She's a lovely, lovely person. We are very different people though. And I think practicing with her, I thought, well, if she got in, I'll just do what she did. And it doesn't work like that. You know, you have to go in and be your authentic self. I know it sounds ridiculous, to just say like, go in and be nice, like go in and be charismatic, go in and be personable. That is all you have to do. I think if you can go in and say like, they're taking 100 different personality types, and there's going to be the best in every one of those categories. Surely I fit into one of the categories. I'm just going to try and be the best version of myself today. And that's really it. I think like it takes a lot of like self-reflection and confidence in who you are to like reach the point where you're comfortable doing that. I was not at that point the first time I applied. I was closer to that point the second time, and I think that's why it worked out. But really just like use your strengths to your advantages. Don't try and hide your weaknesses because they will see through it. But just like really be like authentically you. And I think that also kind of touches on the next question in the chat. Um, what helped you in success in your application? Yeah, just like authenticity all the way through. It sounds stupid. It sounds like bogus advice. And I know like when I was in your position and people would tell me that, I was like, but tell me like the secret ingredient. Like what did you like? That's it. Like that is it. I don't know if Emily wants to like add.
I think what helped me getting in the year that I did was I had not really shared that I was applying to medical school with even like my best friends. I just get very stressed. I didn't want people being like, "So have you heard?" Like I didn't need that. And then the year that I got in, I did tell people that I was applying, and I think having that support system made the difference for me. And along those same lines, I guess I was lucky in that I worked in a hospital and had access to a lot of physicians. But again, like the ambassadors are around, you can always just find us online and get our emails. Talking to people who have gone through it and are kind of impartial, and I would ask anyone like, "Can you practice a few interview stations with me?" And like they don't care to be mean because they don't know me, whereas my friends are going to want to be nice, you know? So I was talking to anyone who would listen. I was seeking advice from anyone who would give it, like just asking around because so many people go through the process. And like Sab said, there's so many different personalities that maybe one person, one thing says is going to resonate with you, and another thing that someone else says is going to resonate with you. So really just asking and gathering all the information that you can to like kind of mold the best you. What was the next question?
What's one thing that set you apart from other applicants during interviews? So once you get an interview, you actually have to sign an NDA, which is kind of crazy, but you sign an NDA before you do it about the content of what they ask during the interview. And then you also don't see anyone else. Since COVID, they've moved it to an online Zoom platform where instead of going from like room to room with different interviewers, and different kind of like interview components, you're instead like rotating through on Zoom. So you see other applicants before you get split up into breakout rooms. But other than that, like there's never a point where you're like standing in like a reception room waiting to go in with them and chatting. So you genuinely don't know. I wish I had a better answer to your question, but I also think that like to that point, another thing that I kind of had in my mind of like what am I going to do and say and how am I going to act that'll set me apart. I think sometimes when you turn it into too much of a game, you lose that kind of like authenticity, right? Like, I think if you were to have just a normal everyday conversation with someone you meet on the street and you were thinking, how can I get them to like me the whole time? They probably wouldn't like you as much as if you just went in and said, I'm going to be pleasant and normal and hope that it goes well. You know, like people can read through an act. And I think going in and thinking, like, I'm gonna hope that like who I am and what I've done and my experiences that have brought me to this point do set me apart on their own, you know, or at least like make them think I'm a likable, kind, empathetic person, like whatever it may be that you're trying to channel. Just like channel it for you, don't channel it for like, you know, one-upping the next guy, if that makes sense.
Yeah, and I'll just add, like, the way that McGill interviews works, I don't know if anyone knows, like, the structure of an MMI. I can just quickly run through that. So is it 7 or 6 stations now? I don't,
I want to say
seven.
seven.
It's seven. So the first half of your interview, you're going to have three separate stations. There's a math station, there's a graph station, and there's a standard interview station. So the math is like, how many soccer balls can fit in an Olympic-sized swimming pool kind of thing. So like kind of just they want to hear your thought process. The graph is they just show you a graph and you discuss your findings, and then standard interview is standard interview, like they're asking you about you. When it comes to the standard interview, it's the same questions across the board for everyone interviewing that day. So that's your time to like really show you and set you apart. And like they're going to ask the same question, but I'm going to have a very different answer than Sabrina's going to have because you like if I tie in my experiences, everything I've done is so different from Sabrina, and that's just a way to show you and your authenticity. And it doesn't have to be something like crazy. Like I don't know, I hiked Mount Everest. Like I think I told them I was reading like Court of Thorns and Roses. Like I don't like you. I was just me. And then the second half of the interview is like actor scenarios. So they hire actors and they want to see how you handle a situation, and they're kind of like outlandish situations that would never happen in real life probably, but they just want to see how you work through it. So it's definitely a very interesting interview. It's very hard to show you in the math or graph station because it's numbers. Um, but all the other stations are a really good opportunity to just show that you're empathetic, show that you're caring, show that you're listening, show, and then standard interview is like That's the longest one. That one's 14 minutes, whereas all the other ones are 7 minutes. Um, so you have a lot of time to really just, like Sab said, be your most authentic self. Because you don't want to get accepted as someone you're not, and they can see through it when you're being someone that you're not, and like you're just trying to answer how you know or how you think they would want to hear. And what also helped me is like what they would want to hear. The people on the other side of the Zoom are kind of people like us. Like they ask medical students if we want to be interviewers or like be the graders. They also have lay people like not in medical field, so it's like just random people kind of. So it's not always so high stakes that it's like, oh, the chief of the program is the one doing my interview. Like it could be one of us kind of thing. It's not, but it could be. Um,
Maybe one day. Also one more point to that question. I think like at the standard interview station, like they'll ask you a variety of things, but like you'll probably get a question or two that allows you to touch on the content of your CV, which they haven't seen. It's a closed file interview. Um, I think that's just like one more reason to like put things on your CV that you love and like do things in your everyday that you love because 99% of people will talk about something they enjoy and like just light up, and like it's nice to hear about people talking about things they like. They come across as personable and friendly and interesting and like dynamic. So if you can like really like pinpoint, what do I like and what I think will translate to show that I'm just like a real nice person, I think that like really speaks volumes about like the thought that goes into getting to the interview and like why you're here. The next question is, how did you study for the Casper? I took it twice because your scores are only valid for a year, so I had to take it both times I applied, but I got the same quartile both times. You can find like practice questions online. There's like BMO ones. I only did the free ones because there's some that you have to pay for. Or you can like honestly Google like practice Casper Reddit. Like you can find random ones online. Um, I wouldn't overdo it with Casper. I think once you get comfortable with your kind of like thought process and like have a kind of methodology of how you answer each question, I think you're fine. Don't compare your answers to the like expert answers you see online because they're like literally this long and you're never going to be able to write that with the time constraint. And then one note on the time constraint is if you are not a good typer, I would honestly spend more time practicing your typing than practicing the questions because like you want to get in as much as you can.
yeah, honestly, I did not study for Casper. I just had
Yeah.
faith that I was an ethical person. But I'm a slow typer, and so I just practice my typing.
Um, does MCAT improve your chances of getting in? I mean, in the sense that it allows you to cast a wider net and apply to more schools, yes. But as I said, only applied to McGill both times. Had I not gotten in, I 100% would have written the MCAT and been like, okay, girl, like it's time to move on and apply elsewhere. You might have to pack your bags and leave. Like it is what it is. But yeah, I think it's like a pretty like rigorous process preparing for it. I wouldn't recommend studying for it while in undergrad courses, but to do it over a summer, like absolutely feasible. I think that's what most people do. Um, and then in turn, like even if you wrote it and you're applying to McGill, they won't look at your scores. So does it improve your chances? Let's say you do super, super well at a school that doesn't look at scores like McGill. Like, no.
And I don't think it has any advantage. Like, I don't feel that I'm at an advantage because I studied all this basic science being in medical school. So it's like, it's not going to get you ahead at all just to have all that knowledge in your head. I don't even remember most of it, to be honest. Um, yeah. And I wrote it during the summer. I would not have been able to do it while also taking a full undergrad course load.
If
Um,
you want dentistry, I never applied to dentistry. That was another thing that I was like, maybe if I don't get in, I'd consider that. Like, I'm not like thrown off by the mouth like a lot of people are. So it was like an idea that I was toying with, but I never did apply. I think it's the same application though.
I know they interview with us, like it's a med dent day. I think there's one extra test to take. Do not quote me, but it's some like soap carving test. I have a friend who's a dentist and I remember her practicing carving soaps. So, um, don't quote me on that, again, we also went through this process like a while ago. We're a bit older, but there might be one extra test.
It'll all be like, I think the McGill website's pretty clear about
Very.
the requirements, so it'll all be there in black and white for you.
Any other questions, comments, concerns? What is your course content like? Different. So yes, very different from undergrad classes. So the way McGill works, and actually most Canadian med schools at this point, is it's divided by system. So it's not like, okay, we're doing all of anatomy and we're doing all of, or like we're doing, like 1 hour anat, 1 hour pharmacology, kind of like you have in undergrad where it's like you have your classes at the same time and you register for 6 or whatever classes and that's your schedule. So it goes by body system. And in that, we do all of the anatomy and all of the pharmacology and all of the pathology and all of the physiology and all the things. So it's definitely a very different structure from um, undergrad. They are pretty good at organizing it in terms of like pathology week and then like physiology week so that it's not like okay in the morning we're learning the anatomy in the after and then we have like one random pharmacology lecture and then we're doing pathology for the rest of the day. Like it is pretty well organized. There's some blocks that are better than others. So like for example, we start with the respiratory system and then we do the heart and then we do the kidneys and then we do GI and then we do
And
defense.
like, defense.
So like an immunology kind of thing. That one's definitely the most like basic science heavy, whereas the rest are more like, organ systems. There's some basic science, but not much. Then we do infection, then musculoskeletal, where the kin students usually kill it, and then reproduction. And now we're in our last block and we're in neurology. And then after that, so as of year two, you go right into the hospital. So we will be starting in the hospital as of January. You have some classes, but then it becomes like once a week, and then it becomes even less as you progress through medical school. But like the what you learn in the classes, I would say, like having taken anatomy in undergrad versus anatomy now, I mean, like anatomy is anatomy. You're learning the same thing in a very, it's more clinical in terms of like, oh, your patient kind of presents with abdo pain. This is pr the most likely spot that's affected. But the layout of how your courses are structured and how your semester and then year is structured is very different from undergrad.
Yeah, I second all of that. I think if anything, like content-wise, med school's easier.
I agree
I
with
don't
that.
want to jinx it. We have like 2 weeks left of class. They better not be the worst 2 weeks of my life. But up until now, like content-wise, I don't think it's too bad at all. It's high volume, and that's why we spend so much time in the law library, like working our little butts off. But other than that, like not too bad. I also think like you're going into it a bit older. You have more kind of experience in school under your belt. You figured out your study techniques and what works for you. Um, so like you figure it out. Everyone has like a block that they like, a block that they don't like, but you get through it. It's also like they'll throw in like interspersed with all the content, these like little like how to be a little doctor classes of like how to take a physical exam and take a history and whatever, like it's cool. Like it reminds you of like, oh my God, I'm gonna be a doctor, keeps you on track, um, kind of like makes it feel real. But other than that, like the content is pretty standard, like Emily said, to what you would have learned. Like anatomy doesn't change.
Anyone else?
We have some questions that were submitted ahead of time when they filled out the form, if you don't mind, but I don't want to take up too much of your time. So some of these you answered. One question is, do you have to, I think you might have answered, do you have to complete your bachelor's? I mean, these students are doing their B.Sc in kinesiology. Do they have to complete that before applying, or can you apply while you're still in your bachelor's or like completing it?
So you can apply to the French schools without completing your bachelor's. You cannot apply to McGill without completing your bachelor's. Um, for the French schools, you do need to take a French test, which is quite hard, and you need to get a perfect score on it. So that's definitely a deterrent. And I think they're changing the rules in that, like, if you're in your third year, you can apply. If you're at, like, I don't know the exact things anymore, but I know French schools you can apply during undergrad, whereas McGill you cannot. Same with Ontario schools. If you do choose to write your MCAT, you can leave and go at any point.
I think for McGill, they changed the rules this year where you can apply if you have under 12 credits. So that limits you to like one semester of four classes, basically. So for all intents and purposes, no, you cannot unless you fit those very specific criteria. Um, yeah. But I loved my undergrad and I think like it does help you grow a lot. So don't let that like deter you from taking the time.
For a French test for McGill, I'm seeing in the comments here, both of us are from Quebec, so we did not have to write a French test. I know now if you're coming from out of province, you do need to write a French test, but the grade that you need on this French test is much, much lower than you would need for the French schools. It's the same test, but it's like a significantly lower grade that you need.
Great. And I have a question here. You answered it a little, but what electives are recommended to A, improve your chances of getting accepted to medical school, and to B, make medical school easier after being accepted?
That's a good question. It says it somewhere on the McGill website that like they factor in the difficulty of your courses, where like if you're taking like 400 or 500 level courses as opposed to a bunch of 300 levels, like that, increases your odds. I don't believe that personally. I did take a lot of 400 and 500 level courses, but only because those were the ones that seemed cool to me. Like, if I'm being honest, I don't think that I ever chose a class thinking this is going to be really good for med school. Like, if you like what you're doing and you're motivated to study, I remember taking like two bio classes one semester where one was on recommendation from other people telling me it was an easy A, and then the other one was I was told to drop it by like everyone who had taken it. And I did significantly better in the one that everyone told me to drop because I liked it. So I think if you're motivated by like just enjoying the content, I would go that route. If not, I don't know how like your electives work in kin, like what you're allowed to like kind of like take from, but physiology, I would say you're all going to be anatomy stars by the time you're done your undergrad. So like I wouldn't worry too much about that. But like try and focus on like your physiology, maybe pharmacology, just to like get the bare bones of it. But like there's nothing like super specific that I would say like will set you apart once you're in and like ease the load. I don't know if Emily has.
I don't think I'm the right person to answer this. I only had three electives in my undergrad, and everything was like nursing. Nursing is its own little bubble. I took Bio 200 as one of my electives so that I could apply to certain schools like U Ottawa, because U Ottawa does not require your MCAT, and they have a French stream, so it's easier for Quebec students to get in there. But you needed like a some form of biochem course, which I didn't have from CEGEP or nursing. And then I just took like random courses that I had heard were easy A's to bump my GPA. Like if I'm being totally honest, your GPA is a big factor in the application. It's 70%. So I was like, I don't want to get a bad grade in this and it dropped my GPA.
Yeah, Chem 181 and Chem 183. They're not going to help you once you're in med school, but they might help you get into med school. So,
And then just another one I have here is, and you did answer it a bit, but I think like maybe some more information would be good for students. Importance of volunteering and clinical hours and how and where to get them. Someone asked to know about.
Yeah, so again, your CV is only worth 10%. So it's not like the most imperative, but it's definitely if they're getting to the point where you're looking at your CV, you don't want it to be half empty. Volunteering like definitely have some volunteering on your CV, like no question. It doesn't matter what you're doing. If it's something that you love to do, if it's something that interests you, if it's an organization, that's volunteering. That's awesome. An organization comes in so many different fonts. Like really just do whatever makes you happy and like won't make you upset every time you're going and just feeling like I'm doing this for my med application, like that's no fun for anyone involved. So it doesn't matter what you do, but definitely you do need to do, or I would recommend that you do something. Um, what did I do? I think I just volunteered at a food bank, honestly, and then I Special Olympics Canada because again, my theme was kind of like sports, because I like sports. Um, in terms of like research, is that what you mean by academic involvement? Or I'm going to assume that that's what is meant in the question, just because it is hard to like tap into that market. So maybe it's a good idea to talk about it anyways. Research is difficult to get into when you're coming from undergrad and you're kind of just sending cold emails and just being like, "Hey, I'm 19 years old and want to go to med school, like please let me help you." You got to do it. Like that unfortunately is basically the only way to get anywhere is to just send cold emails and put yourself out there. Eventually someone will bite. So the summer I was writing my MCAT, I had started doing research at the Jewish in gynecology oncology just because I sent out a million emails. I was like, please accept me. And this one person wrote back, they're like, we're doing a study on COVID. We just need someone to call patients and like check in on them. So you don't really need any research experience for that. You don't need like anyone can do that basically. I've been at that lab ever since. It's been almost 6 years now. I'm first author on a lot of their papers. I'm doing like actual research with them now that's not like just picking up the phone and like checking that their patients are still alive. Um, so you just have to start somewhere. It'll then snowball because then I'm with the gynec department and obviously there's medical oncologists that are and they're like, "Oh, you're in med school. I need help. Like, can you come help me?" Or, "Oh, your project is on this. Like, let me refer you to someone at this hospital who's doing this." Like it kind of all just starts snowballing. You do still have to put yourself out there if you want to break away from that. But I think the best thing I ever did was just sending out a bunch of cold emails on one random summer day in 2020.
Yeah, I agree. Like it's tough at the beginning when you have like no leg to stand on in terms of like proving your competence and your like ability to be a good lab member. I got my first research opportunity through the NSERC USRA grant. I think the applications are due in March. I applied for it like 4 years ago, so don't quote me, but like definitely still an option if you guys are looking to do something this upcoming summer. Um, it's great because the government is paying you, the lab doesn't have to. And so for a lot of PIs, essentially to get the grant, you fill out a component, a PI fills out the component. You're more likely to get a PI to bite if you tell them like, you won't have to pay me, I'll just be free labor in your lab. Um, I ended up getting the grant and then from there moved on to I'm gonna give him a shout because he's always looking for people, but the Hanrahan lab, John Hanrahan in McMed, 10th floor, he's such a king. Like he is such an incredible PI, like great person, great researcher. He researches cystic fibrosis, so if that's something that's of interest to you, he's awesome. So I started in his lab for about a year, gave me a lot of really cool experiences, and then I started in my master's lab at the neuro. But yeah, none of my other than like once I started doing research in med school, none of my prior research was like super clinically oriented. Obviously, cystic fibrosis is like we're doing research ultimately for the patient. But sorry, my mom just texted me. But like it was like wet lab sitting in a bench. Like it wasn't super, it didn't feel clinical. Um, but yeah, like you'll kind of learn the ropes. Cold emailing becomes less scary the more you do it. Um, just again, like find something you like. If the first lab experience you have is the worst one you will ever have, like we've all been there. And I really liked my lab. That's not me saying I hated my first lab. But like send out the email and like try it out. I think it's important, but like it doesn't have to be your be all end all. So, um, is there a specific time during the year? Unfortunately, no. Like this is in reference to when you should start sending emails. I'd say like spring is a good time if you're looking to start working in the lab in the summer. Certain grants, like the one that I mentioned, have application deadlines. So if that factors into your decision, I would obviously abide by those deadlines. But like different labs have kind of different needs depending on where they're at in terms of like starting projects, when they're receiving funding, when they're able to start projects because of that funding. Lots of different like factors go into when they might need people and when they might not. So like when you got the motivation and when you've got like a lab in sight, like just go for it is what I would say. Um, Yeah, another really good route actually, and this also speaks to an earlier question. The last lab I was in before my master's lab, Dr. Hanrahan's lab, my king, um, I started doing, I think they're called 396s, like the research electives, and that's a great elective to do because it gets you credits and it gets again like a PI gets like free labor out of you, so it's a win-win on both ends. And then once my 396 was done, I continued. So that's like a circle back to that question. If you have time for a 396, do it. Like great experience.
Just from personal experience, and I don't know that there's any science to this, I feel like I've had the most success emailing in the new year because I feel like everyone's like, I'm gonna get this project done this year. Like this project I've been putting off, or this project I've been thinking about, like January what, like just from sending cold emails for a lot of time. I feel like the beginning of the year is a good time, but that means like if they say yes, you're starting the project. So you have to be prepared to like devote a few hours a week to go, or like skipping class and going. Whereas if you want to do it in the summer, then yeah, like Sab said, springtime. There's also a question here about fluency in French. I'm not good at French, but we live in Quebec, so like it's kind of like a double-edged sword. Like you don't need it. It's not necessary if you're doing research on in the English hospitals. All their charts are in English. All the patient charts are in English. Your abstract, your manuscript, like it's going to be in English. But if you're having to interview patients, it is expected that you know French. Um, Most of the time, though, patients and doctors are they're just so like they're happy for the help. They're happy to be talking to somebody. They're happy to contribute to research. Like if you mess up one word and you're like, sorry, I don't know this word in French, like I'm gonna say it in English. Most people are fine with it. And it does come. Like I am clearly the most anglophone person in the world. I just wrote an entire French manuscript. Like it comes. It comes faster than you would think it does just because you use the words so much.
I do have one question here that I'd just like to ask. Is there something like, what would you suggest for someone who has a lower GPA? So the example that was given was below 3.7. Is it worth applying? And if so, are there ways to counteract that?
It's a tough question.
Yeah.
Because
It's
how
also
it,
tough 'cause
oh
we
no, go
don't
ahead.
know. You go, but like
We don't know, but how it's speculated is that if you don't have a certain GPA, they just don't look at the rest of your application. Like that's the first step is that they look at your GPA. And then if you, let's say the number that they do choose is 3.7, like they're just not looking at your application after that. We don't know what that number is. And I know people who have gotten interviews with like a 3.5 GPA. Like last year, I'm actually thinking of someone in particular. So it's like, it's not like it was so long ago. Um, you want to then have a great, like a probably a perfect Casper and a great CV at that point. Um, I do think it's always worth applying because you never know. We don't, no one knows what the system is. Um, and that's still a very competitive GPA. Like a 3.7 is an objectively good GPA. It's not if you were telling me your GPA was a 2.9, I'd be like, no. A 3.7 is objectively good. Um, so I think it's always worth applying.
yeah, I agree. Even if it's just to like learn the ropes of the process of applying, I think it's worthwhile. The McGill application is a pretty like straightforward one, but I know some of the Ontario schools ask a little more of you. So I would still apply. Um, and again, like we literally don't know. Like I think these things are kept on the down low for a reason, but there are people in our grade who've done multiple undergrads, because in that case, the more recent one will count, GPA wise. There are people in our grade, like I said, who are in their 40s and like their GPA is from a long, long time ago. Like, how are they weighing these things? Like, we don't know. So if you want it, I think you should go for it. And it'll also, you might go in and think like this won't be my year, but I'm just gonna see what happens. And then once you see what happens, you'll figure out what like appropriate next steps are. Um, so yeah, I wouldn't like count yourself out.
Yeah, and if you're thinking like, oh, I want to apply to med, like I think you owe yourself the shot. I mean, applications are still like 300-ish dollars. So if you have the means, I think like You owe yourself a shot.
Well, thanks so much. I think if anyone has any last questions, they can speak now. Otherwise, I think that's a little over time. So, yeah, thank you so much for joining us today.
Feel free to email
Oh,
us.
there is one.
If you want to go to medical school, what do you recommend? And you wait and decide. Oh, that's
Something
a
you
good.
like.
Yeah. I
What's
knew
something?
research was never for me, which is why I did nursing as an undergrad, because if I was in a nat or in a bio or in something like that, like, and I didn't get into medicine, I didn't want to work in lab work is so important and contributes clinically and is so necessary. I just never saw myself, given my personality and what I like in that setting. So that's why I chose more of a career program. But there's no right answer of like what would be good to do in the interim. It's really just something that you like. And if you don't get into medicine, because it's never a given that you're going to get into medicine, that like you can envision yourself doing for the rest of your life.
Yeah. I think I knew like my chances were like good to eventually get in. And so I told myself like a master's is 2 years. That's like in the grand scheme of things, not a whole chunk of your life. I ended up finding a lab that I really, really loved. Not someone I cold emailed, but someone I was put in touch with from someone I had cold emailed. I think like meeting the right people who like kind of see your vision and understand where you want to end up will also like help point you in the right direction. But yeah, like I wasn't in the same position that Emily was in. I couldn't have worked for more than $15 an hour with my undergrad. And I was offered a really, really incredible project that I cared a lot about. So that's what I did. But I have another friend who like worked essentially doing research, like doing what would have been a master's had she been enrolled in a project, but she wasn't sure that she wanted to get a degree out of it and commit to that. So like she worked in a lab and like there are multiple ways to go about it, whether it's research, having like a, big girl job like Emily had, like just make sure you like it and make sure it's like adding to you and your growth in some way.
Is it valuable to wait or does it reduce your chances of getting in? It does not reduce your chances. I mean, I think it does not reduce your chances of getting in later on. If, like I said kind of in my presentation, it's a lot. Like being in going through the application process, first of all, is emotionally taxing. There is a financial aspect to it. You need to do a lot of things, like it's rigorous. And then med school itself is not easy in terms of the content, in terms of all the things you have to be doing on the side, in terms of just everything. Um, so if it's not something you're 100% sure about, I would recommend waiting and maybe doing something else first just to say like, no, now I'm sure that medicine is what I want to do, which is honestly, I'm so grateful for nursing because that's exactly kind of what my trajectory, even though I had started applying earlier, I'm kind of grateful that I didn't get in right away because I saw like, no, I want to be a doctor. I'm going to keep applying because I'm sure now that I want to be a doctor.
Yeah, I agree. And is volunteering in a lab the same weight as working in a lab? Yes. They're they're not like splitting hairs over that.
I've
And
never
also,
gotten paid for any research I've ever done.
yeah, to echo what Emily said about like being happy about when and how you got in, I think like I have like a whole new perspective that I wouldn't have brought to the table had I gone in the first time. Also, like I distinctly remember us sitting down at lunch like every single day for the first like 6 months of med school and being like, imagine if we hadn't met each other. Like imagine if like our friend group hadn't, so like you'll find little reasons along the way that make it abundantly clear to you why it happened the way that it did. It sucks when you get like doors slammed in your face, but it will all work out. I don't think that things happening on your timeline make them any more or less likely. Like you just kind of have to like ride the wave, I think.
Amazing. Well, I think that's it for today. I'm sure everybody wants to have dinner and all everything else. But I mean, you guys said that they can reach out to you by email as well. So yeah. Well, thank you, Sabrina and Emily, so much for joining us today. I think it was really, really useful for the students. So I hope everyone enjoyed it. And yeah, we should have this recording up on our YouTube sometime soon.
Awesome. Bye,
Thank you for
everyone.
having
Thanks
us.
for having us.
Bye.
Bye.